Hey everybody, welcome to tonight's live. Hi Doreen. Hi Connie, Constantina. All the gang is here. Heidi's here. I love it. I'm good, Connie. How are you? Everything going good? Carol's here. I love it. Hi Tacoma. Have you got your tea, Tacoma? I had a crazy day. So I was almost like super late tomorrow. I think as a 1 minute over anyway, getting started, just rushing around. And I did this really quick video that was the invite video to you guys. And I noticed like my hair was kind of crazy and it's like due for like my usual like check-in kind of thing to get the roots and stuff. Sipping mine. Yay, Heidi. Got it in my hormones today. Yay, Tacoma. I'm so excited. Um, yeah, and as I was doing my invite video, I'm like, oh my gosh, I have all these flyaways. I like totally like it was just a crazy day. So I don't know. You guys don't reveal any private medical information, but anybody out there struggling with hair loss? Has that been a thing that you're dealing with? Because tonight is all things hair loss. So I'm going to tell you some Constantine, yes, Shelly, yes. Okay, so I'm going to tell you some things that you might not have known before. But the very first thing that I want to get out of the way hasn't grown in 2 years. Oh, Sherry, okay, we got to work on that. The very first thing is that if you don't leave right now because I don't know if this will work. Oh, I totally like messed up my hair when I did that, didn't I? So my hair is like doing this crazy thing, and it's on flip. So I don't even know. I don't even know what's going on. So anyway, okay, I'm just gonna ignore that. Oh yeah, I just shared this. Okay, so my link in bio. If you leave here and all my videos, there is a link, and it'll take you to something called a link tree. And in that link tree is a free download of my hair book, and it's called Root Cause, absolutely free. And it'll ask you for your email, and then you just immediately have the download. Alopecia in my 20s. Oh, yeah, it's crazy. And you know what's sad, Carol, is that it may well have been misdiagnosed or not diagnosed correctly at all, and you've suffered all this time. So understanding this stuff, you guys take some notes tonight. Understanding this could help. I did the video last night on a letter to our daughters and how we can help them, because the medical world just wants to throw drugs at people. And there are some medicines that will help, and we'll talk about those tonight. But the underlying cause is really what you want to get to. So if you go to my link in bio, there is a book. It's called Root Cause. It's a free download, and it is so comprehensive. And the cool thing about it is I take you through step by step, and you can see based on where you lose hair, the pattern that you lose hair, and how, like, there's like, it'll tell you how to do the pull test. So when you pull, see, like, I don't have any hair coming out. So maybe, okay, like 2 or 3 strands, that's normal. But if you pull and it pulls a lot, and not too long ago, and we'll talk about this too, not too long ago, I had my hair done, and the girl got it wrong and she almost totally fried off all my hair. So for a while it was like breaking off on the ends. And so finally my new hair girl like understands my hair, and we've done really good. And as I'm looking at my hair, I'm like thinking this is not a good hair night. It's been a long day. So anyway, but okay, what is this doing here? This is crazy. Okay. Anyway, it looks like I'm sticky. Okay, I'm gonna stop. I hate being able to see myself in this because we are our own worst critics, aren't we? Okay, so hello, Susie and Renata. Okay, so we're going to get right into it. So again, go to my link in bio, and also we will ask you for your email. And the cool thing about getting your email is that we never know how long this platform is going to be here. And if you like this information, I can email you and let you know where I am. And I'm here every night at 7 o'clock. So hopefully I will be like forever, but we just don't know, right? So I'll let you know. But I am on Instagram and Facebook, and I stream all these on there too as well. So you can go find it. Oh, I'm just now noticing that my camera was icky, so you couldn't even hardly see me on the other one. So yeah, and just never know like what's going to happen or where I'm going to be. So yes, absolutely. Okay. So here we go. Hair, hair, hair. So the number one thing is to find the root cause, because if you don't know what the root cause is, you can't fix it. And yeah, maybe there's medication, but do you want to take that medication forever, right? And so actually bioidentical hormones, if you've already gone through ovarian failure, I always say you're going to have to take hormones until they figure out a way for us to regrow ovaries. But other than that, we don't want you to have to take medication for your hair. So I'm going to go through the list, but I want to point out that 40%, and maybe even more because I see it all the time in my practice, but 40% of women will experience hair loss over the age of 40. And what happens first, Eileen, what happens first is that the hair strand itself starts thinning, and then hair loss starts to happen in different patterns due to different things. So my goal for you tonight is that by the end of this, you understand exactly what your hair loss issue is so that you can fix it. Okay, so the next thing that I want you to understand is these root causes. I've got 13 on here, unlucky 13, right? So we'll just go through them one by one. The number one root cause, I'll keep saying that because it's just fun, is ferritin hair loss. So what the heck is ferritin? Ferritin is a protein that carries your iron around. And we start to see younger women who are having estrogen dominance and heavy periods start to have iron deficiency. And if you're having symptoms like you're tired and you're bruising easily, you feel like you could pass out sometimes, or you get lightheaded when you stand up, if you have estrogen dominance and your periods are heavy, so you could be bleeding out the iron. What happens is, even if you get a doctor to check your iron, if you can get them to, I mean, that's just clown world, because they don't even think that way. They're just like, throw medicine at you. And it could even be that the medicines that they're throwing at you are making it worse. So we're going to talk about medicines too. But it's just so crazy that if you get them to check an iron level, it might be normal. And they'll say, oh, your iron's normal. But there's a range, right? So there's a range of 20 to 150. And if you're at 30, what do? They tell you you're normal, right? But that's low normal. And if you have other issues, that might not be normal for you. And so when you look at iron, that's not the best assessment because that's only the iron that's in your blood at that moment. Yeah, it happens. So what you want to do is get something called a ferritin level. What is ferritin? Ferritin is a protein that carries your iron into the tissues, into the hair follicles. And so if your ferritin is low, then that means you have an iron deficiency. Even if your iron is not like in the 20s, you might still have an iron deficiency. And so ferritin, the ranges are usually, it takes more than 50 for you to not start losing hair. It takes more than 70 for the hair to just not change. And then it's more than 100 if you want to regrow hair. So really your ferritin should be in this range. So if you can get a doctor to check your ferritin if you're losing hair, and I'm going to talk about all the lab tests here in a minute, that could be the root cause. I'm having fun with that. So ferritin. Okay, number 2 is, of course, hormones, right? So I'm going to break this down because I'm going to talk about your estrogen, progesterone, and testosterone, of course. But I'm going to save thyroid, even though it's a hormone, and insulin for a different step here because it's absolutely do affect things. But I'm going to talk about sex steroid hormones here. There we go. Sex steroid hormones. And so if you have issues with menopause specifically, I have to draw this picture. Ferritin score be included in the hormone saliva test. No, we don't check ferritin because we really just focus on perimenopause and menopause or estrogen dominance issues. So what she's talking about is our saliva test, which is our entrance into your life, getting your life back. But so this is a saliva test, and basically what you do is you just put your saliva in this little tube and you put it in here, and then you answer all the questions about all the symptoms that you could possibly have. And there's like 70 of them on here to be exact. And all the things from sleep issues to brain fog. I almost did brain fog tonight because I was feeling a little brain fog today. Any of you guys have brain fog? It's just, yeah, it's part of it, right? Even when you're on hormones, just stress and busy and all the things. But yeah, so many things can be attributed to menopause or hormone imbalances that you don't even think about, like neuropathy, and I always say frozen shoulders. That's fun. Blood pressure changes, sugar cravings, hair changes. Hair is big. Yeah, yes. So this test for estrogen, progesterone, and testosterone, because those are the main things that we want to test for. And I'll talk about that in just a second, because fixing that could fix all the problems. And especially if you're having hair loss over the age of 40, this is kind of my go-to. So ferritin number one, iron number one. And then once you get into the program and our coaches can work with you, if this isn't doing enough, then there's more testing that we can do, right? So there's lots of things like iron and ferritin and things like that. So we're all about helping you and customizing things, but this is where we start. So if you go to my link in bio, there's also a link to order the test kit, and you can go to hormonebliss.com and order a test kit too. And it's just a little over $100. I think it's $129. And it's a super inexpensive way just to like find out that you're not crazy and that it's actually your hormones. So yeah, absolutely want to go do that. So, okay. So back to our regular programming here. And so when you look at estrogen, progesterone, testosterone, and DHT, I'm going to hold this for just a minute because I wanted to tell you that what we're dealing with hormones, you guys know I always have to do this picture, is if we were to graph our ovary hormones, these are sex steroid hormones, from the age of 0 to 100, and at this midpoint is 50, where most of us hit menopause, and then our estrogens climb, we're a little baby girl, we go in puberty, and then any kind of issues that we have, but this is sort of our hormone cycle: estrogen, progesterone, testosterone. Perimenopause, things get really erratic here, and then start dropping off rapidly, and then flatline. So when we see this happening at about the age of 40, this is our 40% of women have hair loss over 40. This is the hormone changes that are happening right there. So it's really important that somebody has their consult Friday. Yay, I love it. I love it. It's really important that we address the elephant in the room here, because girls here don't usually have hair falling out, right? I mean, it's uncommon. I mean, there's some weird things that happen. Or I remember when I was a kid, I was probably like 10 or 11, and my mom was bleaching my hair, and we used to use those caps. Do you guys know the caps I'm talking about? And you would just pull little strands through, and it would just, like, we call it frosting your hair. So anyway, she was like, oh, wouldn't it be great if your hair was blonde all over? Because I actually had the haircut, because that's actually my natural color right there, and it has a lot of red in it. But she was like, okay, let's make it all blonde. Well, my hair is super, super thick. And so when she put all that bleach on there wasn't enough bleach to cover it, and there wasn't enough time to actually get all the colors stripped off of it. And my hair was bright, crazy orange and yellow, and it was like breaking off. And I was just beside myself. And she was so sweet. Oh, hi, Lisa. She was so sweet, because she was like, she didn't make me go to school the next day, because the only way I could have would to be wearing a hat. And I know my hair looks really orange in this light. It's really blonde. I don't know. I have to work on my lighting in here or something. But so anyway, it was like this, only it was like orange and breaking off and stuff. So yeah, so I totally get that some girls do have hair loss and hair breakage here, and thyroid disorders and nutrition disorders and things like that can happen when you're younger. But most of the hair loss happens when we're over 40. So why does that happen? Because our hormones are starting to decline here, and then we literally flatline. So you guys who know me and are here every night in my tribe, you know that I always say that our ovaries literally dry up. I told someone just today, and I just like the look on people's face when I say that literally 10 years or 15 years out from menopause, if you order an ultrasound, a pelvic ultrasound. The radiologist read will, like, almost 100% of the time say that ovaries are not detected, because once you run out of eggs, when the basket is empty, there's no more tissue there. It literally just dries up like a little raisin. I mean, it makes me think of those, like, 4th of July, those pop things, and then all of a sudden all they are on the ground is just black dust. It's just like, that's what our ovaries are. And so that's what we're dealing with. So when we say 40% of hair loss happens here, this has to be because of this estrogen, progesterone, testosterone balance. So I'm going to just draw what that looks like for just a minute. So our body makes cholesterol. Yeah, cholesterol is not a fatty globule ready to cause a heart attack. It is actually a hormone, and it turns into progesterone, and that turns into estrogen, and there's many different kinds of estrogens, and then that turns into testosterone. So I'm going to talk about the hair follicle here just a little bit. I know this is kind of hard to see, but I just pretty much do this for me to keep me on track. But this is a hair follicle here, and this is like a cross section. So if you took some skin that had a piece of hair in it and you cut it this way, this is the skin. This is what we call the epidermis. And this is the dermis. Epi just means on top of. And this is the hair follicle. So what we're seeing down here, this is fat down here at the base. And these are blood vessels. So this is the arteries and this is the veins. And it is, the artery and veins are literally coming up here into, we call this the bulb, and this is the shaft. And this is a little oil gland right here, because what happens is oil gets into the hair follicle to keep it lubricated so it can come up and out. Where can I find these recorded lives again? Okay, if you go to my main page, so like I'm not sure where it is when I'm on a live, but if you like, even if you just find me, but when you leave here, there's probably somewhere. Oh yeah, up in the very top left-hand corner, there's my little profile picture. If you click on that, it'll have my page with all my videos. There's like 3 billion videos there, and I usually try to repost the lives the next day, but sometimes I don't get to it because the download time takes me probably an hour to get it all done, but I usually try. So are perms bad? Well, it just kind of depends. If your hair is healthy enough for it, I've done the Brazilian blowouts, they call it, so the hair straightening. I have super, super thick hair. In fact, when I was in college, this is crazy because we would take, like in biology class, we would take our strands of hair and we put them under the microscope and like look at different things, but they were like, oh, let's look at our hair. And mine was literally like a rope, like a rope would be with different strands. And then, like, I always called it normal people's hair was like a string under the microscope. And I'm like, what the heck? Will you put recording somewhere? Yeah. So she said, if something happens to TikTok, where am I? So I'm on Facebook under Tammy. I'm on Instagram, Dr. Tammy Tucker, and X and LinkedIn too. So you can find me those places. And if you go to my link in bio and download the hair ebook, then we'll get your emails too. And I can always let you guys know where I am if anything happens. Oh, what happened? Okay. I don't know what that was. Okay. Yes, I get these notices sometimes, and I wasn't even saying anything weird, so I don't know. Okay. So, and sometimes they don't like talking about stuff. So there's a little arrow down there in the bottom to. So if you guys share, sometimes they don't put me out there because it's like she's talking about things we don't. I think people shouldn't be talking about. So yeah, if you share, or if you have friends, that helps too. Oh, hang on. Let me try something. Sorry. Okay, I don't know what was happening there. Okay, back to estrogen, progesterone, testosterone. Okay, so our body takes cholesterol and turns into progesterone, and then estrogens, and then testosterone. So these are enzymatic conversions that happen. And I keep pausing. You obviously, you know that. Yeah, I obviously know that. I don't know how long I'm going to be able to makes me a little sad, but I'm here as long as I can. So, okay. So estrogen, progesterone, testosterone. And so we know that guys have more hair loss than women, right? So why is that? Because guys have more testosterone than we do. But the interesting thing is that women actually have more testosterone than estrogen. So guys have a lot more testosterone, but we are very prone to testosterone changes too. And when things change and we go through ovarian failure after menopause, which is ovarian failure, we tend to have more testosterone than anything else. So now we're left with a higher level of testosterone. And it's usually pretty low because our libidos go in the toilet unless we're on hormones. But now we have a higher level of testosterone compared to the estrogen and progesterone. And so now we have more androgen effect. And that imbalance can cause problems in the hair follicle itself. Normally, or the way this happens, is that testosterone actually converts into a byproduct hormone, I call it, called DHT, or dihydrotestosterone. Why do you need to know that? This hormone right here is the one that is responsible for interfering with the hair follicle growth. So it's the one that makes your hair fall outwards, not supposed to, and where it grows where it's not supposed to and falls out where it's not supposed to. So especially in ovarian dysfunction, which is PCOS, they'll get hairy arms and like a beard and mustache. That's not a testosterone effect. That's an overall androgen effect. So DHT is actually an androgen. And I want to tell you this because this is important, because there are certain things, and we'll talk about meds and treatments in just a minute, but there are certain things that you can do to block this. So there is actually a medication called spironolactone. And this is a prescription. But if you don't want to do a prescription, then there's another thing called saw palmetto. And it's so funny because I had a female patient go to a health food store because I told her to get some saw palmetto because she was having some issues, some acne and things like that, which is good for acne too, because acne is an oil problem. And so anyway, there is the non-prescription thing called saw palmetto, but this lady was talking to the person there and at the health food store, palmetto. Again, not dyslexic tonight. And that person was like, oh, that's only for men. That's only for prostate issues. And it's like, well, it is that pathway, but it's not just for men. We have all the same hormones. So saw palmetto can be really helpful to block that DHT. Also, if you've heard of medications like minoxidil that you can use, or finasteride, things like that guys use to help with hair loss as well, those all work on DHT as well. So one of the interesting things about estrogen and testosterone, I'm going to come down here and I'm going to get rid of this for just a minute so it's not too crazy because I tend to get a little bit scattered here. Okay. So here we are in the skin now. So down here in this fatty layer, and this is so interesting because fat is so important. Pumpkin seed with saw palmetto, yeah. Is that okay to take and use minoxidil sometimes? Yeah, absolutely, Sherry. Yeah. More so, Sherry, though, we need to figure out what's causing it, right? So if it's the lack of ovarian hormones, if you don't do that, then the other things are like never going to work, right? Or you can't really take saw palmetto and, not have balance with the other things too. But yeah, absolutely. Okay. So down here in the fat, we need fat. Our bodies need fat. Now we don't need visceral body fat, right? But the liver makes cholesterol, which makes fat. We need fat in our brains. Our brain is like 90% fat. I mean, it's like we need lipids. And so the lipids are super important. So this little fatty layer down here is where estrogen, vitamin D, and testosterone sit. And estrogen actually goes up into the hair follicle and feeds the hair follicle. There's something called cortisol, which is your stress hormone. And I already actually split that in two, because what happens is when your body goes through any kind of stress, and that's not just like work stress or your kids messing with you stress, that is any kind of stress or any kind of inflammation in your body. And going into ovarian failure is very, very stressful because it puts the whole system into shock. And women are suffering. They're suffering from that shock of that hormone collapse. And so it's really my passion that you guys share this information and that you be your own advocates, but the advocates to all the women out there to say, this has to stop. This suffering has to stop. And so if you're over 40 and you're going through perimenopause or postmenopause ovarian failure, if we can get this word out and the truth, it will make such a big difference. So anyway, I'm preaching again. I know, but okay. So we're here, and this is the hair right here, and this is the hair follicle. When stress hits, it actually can disrupt this blood flow right here, and the hair can either break here or it can break here. And there are different phases. And so, like, I'm always like, I can't remember which phase is that. Is that the anagen, the catagen, or the telogen? So there's 3 different phases. But these 3 different parts are where your hair can actually break off, and then it can thin, or you can lose like the whole follicle structure ability to regrow hair. So the first thing that happens is in a transition phase like stress, you can have changes, or if you have menopause when you don't have these hormones anymore and your vitamin D is low, because a lot of people have low vitamin D, now you have trouble with getting these hormones up into here to actually feed these follicles. And then that happens, and it takes only about 1 to 2 weeks to have that degree of stress. And so lots of things can cause stress. You can have autoimmune things, you can have chemicals, you can have all sorts of things like environmental changes. So it doesn't take much. Maybe in your test kit you can put maybe 5 business cards so we tell our friends about you. Thank you, Elaine. Yeah, that's a good idea. Been stressed for years. Oh, I'm sorry, Aladdin. Yeah, no, I'll think of like Elaine. Yes, my moderator, my beautiful fiance. Honey, don't forget to write that down. We can do that. Okay. We're also working on a ambassador program too. So yeah, that'll be good. That's next, right? Okay. So anyway, so the telogen phase is about 3 months. So it can take up to 3 months after after a stressor. It can be up to 3 months before you start noticing your hair falling out. So why is that important? Because the cause and effect is a little blurred, because you might be like, what was I doing 3 months ago? But most people aren't going to think, oh, it took that long for this to actually start happening. That's also important because when you fix the underlying cause, it's not immediate. It can take about 3 months for your hair to start growing again. So that's where you kind of have to be a little bit patient with stuff. And then the anagen phase is your growth phase, and that could take 2 to 6 years. And we all know that if you cut your hair, it can take anywhere from 2 to 6 years to grow it back out, right? So the stress phase of the catagen is the biggest thing. So any kind of stress that you have more than about 1 to 2 weeks is significant. So our hormones are very, very important. Our fat is very important. And again, not being overweight fat. And our oil is very important here. So keeping the skin hydrated. One of the things that happens with thyroid disease is, and that's one thing that in the book, if you guys are new on the scene here, if you go to my link in bio and you go to my link tree, there is a free copy of my book, Root Cause. And I talk about all these things, and you can self-diagnose because I have pictures of the patterns of hair loss and things like that. And so if your hair is dry and breaking at the root, sometimes that can be chemicals, but sometimes that can be because you don't have enough oil in the root. I have had a lifetime of autoimmune thyroid disease stuff. I don't anymore because I've healed my gut and my hormones are balanced. But that's the main reason why thyroid hormone, I'll talk about that in a sec. It's the main reason why thyroid hormone makes you lose hair. It's really making your hair break off because you need thyroid to keep that oil-based good. And so then your hair just dries out and breaks. So the oil is very important. Um, Liver methylation. So why am I talking about the liver? And this kind of feeds into genetics too. And I also have in my link in bio a free download of my book, Methylation Solution, which talks about a genetic defect called MTHFR. I know that sounds like a dirty word. I promise it's not. It stands for an enzyme called methyl tetrahydrofolate reductase. I always like to say that so you think I sound smart. But yeah, so it's an enzyme and it converts your B vitamins. So a lot of people have heard that you can take hair vitamins, and there's a lot of them on the market. I think Nutrifoil or something like that is one of them. And they're just a bunch of B vitamins. So it's super important to have good methylation. So make sure that if you're going to take your B vitamins, that they are methyl B vitamins like methylfolate, methylated B12, or hydroxy B12. So that's a whole nother discussion. But if your liver is not converting your hormones, if your liver is not clearing toxins, your hair will fall out. That's just a thing. So make sure that you are taking care of that and a healthy liver. And Tacoma to you, our dandelion tea. I love it. I love it. So good for your liver. Some night, if you guys want me to, I'll do a talk on gallbladder, because I have and I'm not saying don't not get your gallbladder surgery if you have to. Although the number one surgery in the U.S. besides hysterectomy is gallbladder removal, which is an estrogen problem. So that's a whole nother talk. But I have a whole protocol for people with sludge in their gallbladder, which is estrogen. I know it's a bunch of estrogen in your gallbladder, but and it includes dandelion tea and magnesium, stuff like that. But that's a whole nother talk. So, okay. So methylation, keeping your liver healthy, very, very important. Vitamin D. So why vitamin D? Vitamin D is actually a hormone, and it's a fat-based hormone. Your fat-based hormones are hormones like A, D, E, and K. And what fat-based means is that it actually gets down here in the fat and it's stored there. And vitamin D helps with inflammation. So we think of vitamin D like it's just a vitamin. It isn't. It helps with inflammation. It helps with your immune system. It helps balance your other hormones, because vitamin D actually it regulates something called SHBG. You don't have to know that. It's just like a taxi, though. So it allows your hormones to actually get into the cells to do what they need to do. Because if estrogen and progesterone and testosterone can't get in the bloodstream here and get up into the follicle, that follicle's going to die. And it's like I always say, after menopause, ovarian failure, every part of our bodies start to die, because our blood vessels are dependent on estrogen for their elasticity. And we talked about the other night, heart attacks and strokes are the number one reason of cause of death in women. And so we need that. We need it for our skin. We need it for our face. We need it for our continence. We need it for our brain. We need it for everything, our bone density. And so if we don't have that, we don't have it for our hair either. And I just think it's so sad that if you look in the nursing home, you see almost all the women in there have very thin hair, or sometimes just very sparse hair. And did you know the reason that our hair turns gray is a selenium deficiency? Like, who knew, right? I mean, it's like, that's kind of crazy, but that's really the color, the pigment is dependent on selenium. So there's little facts for you there. Okay. So vitamin D helps with the immune system, helps with stress, helps with inflammation. So super important. Okay, let's talk about stress. So stress is not just a bad day at work. Stress is a cortisol elevation. It can be tension. It can be inflammation. It can be autoimmune. But I'm just going to put stress in the bucket of whatever happens. It can be mechanical stress, like girls who wear ponytails all the time. It can be stress on the hair. Oh, I just messed my hair up when I did that. It can be many, many different things. So I'm just going to put stress in that bucket there, because when you have this stress and it affects the blood flow here. That's when you start to have problems into the hair follicle. Okay, nutrition. So we talked a little bit about vitamin D and your methylated B vitamins. Biotin. What does biotin do? You've probably heard about that. It's in the hair formulas. Well, biotin actually helps lubricate the hair follicle here, and it actually helps this kind of sac around the follicle. It gives it its density and its keratin. So keratin and collagen are really important. And we have a wonderful collagen powder. If you go to my link in bio, there's like the other part of it is like my store for all my supplements. And I'm so passionate about supplements. So I have I have methylfolate in there. So if you want a good form of methylfolate and collagen, and I've got liver detox protein powders and stuff like that. So go shopping in the store because I've spent years and years trying to find the best of the best stuff. Okay. So, and zinc. Zinc is very important. I had a guy, I don't know if I've told this story before, but I remember it's when I moved, I just finished residency and we had moved back to my hometown. And the real estate agent who was taking us around had psoriasis, like terrible. And his hair just looked like, like moth eaten. I can't describe it any other way. And I said, I had just been studying some stuff. And I said, you know what? I said, I was just reading about psoriasis and zinc deficiency. And he's like, huh, that's interesting. I saw this guy like, I don't know, years later. I mean, not more than 10 years, but maybe 2 or 3 years later. And he said, you know what? You changed my life when you told me about the zinc because his skin was clear and his hair looked great. So, yeah, it's like, what a weird thing. And I truly believe that God just plants these little seeds to people, when they need to hear it. So that's so cool to me that I had just been reading about that, right? Okay. Microbiome. So the bacteria on your skin is very important too, because they have a very important function, just like your gut. So leaky gut, we could talk about that, autoimmune things. But the bacteria are very important because they keep the bad bacteria in check. And so they're constantly kind of battling for each other for the space, for the real estate, basically. And so there are topical probiotics that you can get. They're very good for acne as well. So some saw palmetto and some facial topical probiotics could be just the thing if you have a young person in your life that is having trouble with acne or hair loss. Biotin can mess up certain blood labs. When I have blood drawn, I was asked if I take biotin. Yeah, it actually can. It can mess up your thyroid too if you're on thyroid hormone as well, because biotin actually helps convert thyroid hormones, and thyroid, your whole endocrine system is just one big system, right? You're not just ovaries, you're not just a pancreas with insulin, you're not just a thyroid. So they all interact with each other. But biotin actually will upregulate thyroid a little bit. So sometimes if somebody has a low grade functioning thyroid functioning problem, of course, if you're menopausal, we fix that first. But biotin can actually help with that, same as selenium and zinc and iodine and things like that. You're absolutely right. So thanks for sharing that. Okay. The next one is thyroid. And so again, if your hair is brittle and dry and breaking off, that is usually a thyroid issue. So that's helpful to know. And a little beyond the scope to talk about all things thyroid tonight. So I'm just going to kind of leave it at that. Autoimmune and all autoimmune, auto means self, immune means that your immune system starts in the gut. So if you have autoimmune, they usually come in threes. So if you've got psoriasis, you've probably got thyroid, you've probably got some sort of another autoimmune arthritis or something like that. So usually you can tell if you've got multiple things going on, you're probably going to have issues with your hair too. Okay, medications. So synthetic hormones, birth control. I did a whole talk the other night on the difference in bioidentical and synthetic hormones. Oh, thank you, Heidi. She said, teaching me so much. I love it. I love it. So yeah, medications. So synthetic hormones. Actually, when you take birth control, synthetic hormones put you into a state of menopause. And so if you don't have your estrogen and your testosterone and your male female hormones, you're not going to have healthy hair. So if you are suppressing everything with synthetic hormones that are shutting down the whole axis of your brain, telling your ovaries to make hormones, then you're going to have trouble too. Plus, those synthetic hormones are made from natural gas, petrochemicals, and there's known carcinogens in those breakdown products from, they tried to make it look like a steroid hormone, but it wasn't. Um, yeah, it's so hard because really for family planning, and Amanda said, I wish I'd never taken birth control. I really truly believe that that is a part of why we're seeing so many problems later on, because they're giving these high dose synthetic hormones with known carcinogenic properties to them. But it is what it is. So, I mean, we just kind of go forward from here. We're constantly putting chemicals in our body all the time. We're constantly putting plastics, like the um, chemicals, the endocrine disruptors. It's in our environment. It's everywhere. So don't beat yourself up about that. I mean, I didn't take birth control because I couldn't tolerate it. It made me sick as a dog. And I just, oh my gosh, I just was out of my mind. And I think that was God's blessing to me because, well, and then it turned out that I had fertility issues because I had PCOS, which is ovarian dysfunction. So I dodged the bullet on that one because I just couldn't do it. So okay, so synthetic hormones, chemotherapy, of course, we all know when people take chemotherapy that their hair can fall out. Blood pressure medications like beta blockers can, because estrogen, actually, different kinds of estrogen have beta receptors on it. So when you use beta blockers, you can actually block some of your estrogen effects. And so you can have hair loss with beta blockers. Plus, beta blockers can change, they change your ability to get blood flow places, because what it does is it slows the heart down so the heart's not pumping. So if you check somebody's heart rate on a beta blocker, it'll only be like 50 where it should be like 70 or 80. And if you're not getting the blood flow to areas, you're not going to get blood flow to the and I'm not telling you to stop your beta blockers, please, please, please. I'm just saying it is what it is, right? So you can ask your doctor if you're on these medications. Some people take beta blockers for anxiety. We talked about that the other night. But yeah, if you're not getting blood flow to your brain, you're going to have brain fog, right? So a lot of people are very tired and sluggish on beta blockers. So it's not a first line go-to for anxiety and, not blood pressure. So things to think about. Birth control for young ladies today. It's tricky, Misty. So I tell my patients, if your family planning is more than 5 years, maybe even more than 3 years, to not have children, I really like the copper IUD. I don't like the synthetic hormone emitting IUD, but a copper IUD. And then if they're having like dysfunctional uterine bleeding or something, then we can use natural progesterone to help balance that out. I mean, it's risky because if you're going to do the rhythm method or something like that, I mean, you take your chances, right? There is something called an estrogen ring, an East ring, they call it. And it's just it's still a synthetic estrogen, but it just goes into the top of the cervix by the uterus. And it doesn't, like a birth control pill, it doesn't go through the system. So that would be my next choice. And the other thing would be the topical patch, the birth control patch, because it's bypassing the liver, because all of those chemicals, the synthetic chemicals that act like hormones, have to go through the liver for metabolism. And if you don't have a healthy liver, we talked about methylation, that can be more of a problem. So I would never take a birth control pill. I would either do a patch or an estrogen vaginal ring, or I would consider a vasectomy if you're like done, not you vasectomy, but for your partner to have a vasectomy. So there's different things that you can do, but if you are going to do a synthetic hormone, I wouldn't do it through the by-mouth route. People take beta blockers before going on stage or TV, and occasionally if you are, going to go on stage. I've never been nervous about being on stage. I've always been just a ham for the camera. So it's really hard for me to like think about that. But yeah, for presentations and things like that, yeah, they will do that. But if you're just taking it every once in a while, not a big deal. And please, if you're on one for your blood pressure or your heart, talk to your doctor. I'm not telling you to stop it, but you might say to your doctor, I'm losing hair. And this crazy lady that does TikTok every night at 7 said it could be that. So, it's a conversation. Okay. Antidepressants. And, the interesting thing is most women over the age of 40, because doctors have this like skewed view of what hormones are and all the things that it could cause, 40% of women are on antidepressants. And, if that causes hair loss, I mean, it's kind of like, which is it? Is it because I got no hormones, or is it because I'm on this medication that's affecting? And really, what it does is it gets that catagen phase, and it causes a little bit of stress in the system. So you're taking these antidepressants to help you with stress, and it's actually stressing your system out. So yeah. Oh, and I did forget to talk about insulin, so I'm going to skip back up to that in just a minute. And then cholesterol meds, because cholesterol is actually the root hormone that makes your estrogen, which you need for your hair follicles. So there is absolutely no studies. I would love for you guys to bring me one that shows that cholesterol medications improve outcomes of morbidity or mortality in women. There are none. I would love to see them if you have them, but there's just a whole different hormone profile in women than men. So there are some in men that show that, but that's a long story. But only in men over the age of 70 who've had open heart surgery would I ever tell, yeah, okay, stay on your statins. But anyway, so cholesterol medicine, calcium. Do you take calcium, right? They're like, oh, it's so good for your bones. Calcium, and you need calcium from your food. Don't get me wrong. You absolutely need calcium. But if you take that elemental calcium that's in the big white chalky, I mean, that was one of the biggest lies they ever told to us, because calcium, if you don't have estrogen and vitamin D, you can't put it in your bones, and it's going to sit in your arteries and clog them up like Lyman pipes. But calcium like that also can decrease your iron absorption. So there we get into, when you're taking supplements, there are sometimes some supplements that you don't take together. I found your page helping to mess myself up even more. No, you can't mess yourself up. There's nothing you can't fix. I always tell the nurses in my office, there's like, unless you kill them, there's nothing that you can do that we can't fix. And then sometimes even then it's just a little CPR. No, I'm just kidding. Okay. But yeah, so calcium can block your iron absorption. So sometimes the timing and what you take your supplements with, like thyroid's got to be on an empty stomach. And so calcium can block, your thyroid's ability to use. Sometimes taking too much vitamin C can increase your iron absorption. So thank you. So yeah, so get your calcium from your food. Don't take it in this narrative that they're telling you to take calcium supplements, because it's not helping your bones. It's decreasing your iron, and it's causing a bunch of other problems, most likely. Okay. Genetics. So we kind of talked about methylation issues, and go to my link in bio and get that book. I am really proud of the methylation book. I mean, I've got a whole bunch of books for ebooks you can download, and you can order all my stuff on Amazon if you want just a paper copy. I love a paper copy book. But yeah, so the methylation book and the hair book, definitely go get those tonight afterward. Okay, hairstyles. So if you use a lot of bleach, a lot of color, you can have allergies to stuff in hair products and not even really realize it, because you won't necessarily like get rashes or wheezing or anything like that. So you can have just little low-grade allergies. So read the ingredients in your shampoos and your hair products and things like that, because that could be a problem. And heat, of course, heat can make your hair break off. That's not where it falls out, but can break off. And I am just now growing hair back underneath here. I, on a trend, saw these people with these curling irons that dry and curl your hair all at once. And because I have really coarse hair, it was like the heat was too hot under there, and it was literally just cooking my hair. So my hair underneath is not as long as my other hair. So be careful when you see those little fad hair curlers, or like the Miami curls or whatever like that. So that can be a problem too. Okay, so I want to talk a little bit about, and funguses. a lot of times you can have fungal infections on your hair if like you have a dog or cat. Dogs and cats will get the mange and fall out. So if I have somebody, especially if they've got like the oral dermatitis or something, or like ringworm patches or something like that, and sometimes just for grins, I'll do a compound for somebody if I can like see weird patches and it's not psoriasis. We'll just do an antifungal or some oral antifungal like ketoconazole or something like that. If I don't have any other reason, I'm like, why not? It's not going to hurt anything. Okay, and you can also, there have been times I have seen people with extreme hair loss after a stressor. And if they have really high cortisol levels or really low cortisol levels, it kind of depends. You kind of have to gauge it with everything else. But you can actually do steroid injections in the scalp if you have those big patchy, mangy looking things, if it's got an autoimmune component. And I have seen people come back from huge patch hair loss with steroid injections. So we try to avoid steroids. You can also do high dose prednisone, which I was watching a video not too long ago and somebody took really high dose steroids and their hair grew back. But it was like, yeah, but they probably gained 40 pounds and puffed up and stuff because steroids, not so great. But okay, so what can you do? First of all, identify what kind you have, where you lose the patterns on your scalp, or any other symptoms you have. Prednisone thins your bones for sure. I think that's like the main reason my mom broke her hip because like she'd been on prednisone for rheumatoid arthritis for years. But any other symptoms? Are you tired and passing out? You've probably got low iron. And doctors just don't. I mean, I routinely check that in my practice, but doctors don't think to check that, right? They just want to give you a pill. Oh, you're tired. Okay, here's something. Or, it's just crazy. So what happened in your life when it started? Perimenopause, menopause. And again, I talked about the phase, that stress phase that hits, and it takes 1 to 2 weeks to have that stressor. And then it takes 3 months for it actually to start falling out. So you can go back in time and go, what happened 3 months ago? Did I stop having periods? Did I go estrogen dominant? Did I have a cyst that ruptured on my ovary? Iron was high. Iron being high can actually be a whole nother can of cats, I like to say, because you can have genetic things where you have too much iron, and too much or too little of anything can be bad. But ferritin is not the same as iron. Ferritin is actually a storage protein. So it's what it's carried around in. Vivian, I'm in Arkansas, but our program, Hormone Bliss, we are nationwide. And so what we start with is we do hormone testing. So go to hormonebliss.com and order a test kit. And we see what your basics, your estrogen, progesterone, testosterone are. Because most of my population that I'm trying to make a big difference for are postmenopausal or perimenopausal or estrogen dominance, ovarian dysfunction things. So we start here. And if we fix your estrogen, progesterone, and testosterone through some bioidentical hormones, we can make a big difference. And the thyroid will usually correct out. A lot of people are just told you have to take thyroid medicine the rest of your life. That's not true. There's a cause. I always say a headache is not an aspirin deficiency. Something is causing that headache. And even though an aspirin makes it feel better, something was still causing it, right? So knowing the root cause is super, super important. Okay, lab tests that you want to get. Of course, I've got estrogen, progesterone, and testosterone. You can get this kit. And then, vitamin D, we can do thyroid, iron, ferritin, zinc, biotin, all the things you can do. So I use bioidentical hormones. I feel so much better. Yay! Yay, I love it. See, I love the testimonies when people are using bioidentical hormones. Women are suffering so bad, and it's so crazy, and it's not fair, and it doesn't have to be that way. I actually have a patient that came in today, and she came in for weight loss, which the number one symptom of menopause, ovarian failure after menopause, to see her without periods, right? It's not hot flashes. And that's the one they want to like just blanket say menopause is hot flashes. I mean, it's just clown world. I mean, you guys who know my rants every night, I'm like, are you freaking kidding me? But yeah, so it's like I had to spend, 30 minutes with her just drawing the graph about what ovarian failure is and what we're up against. And so, I told her, I'm like, we can do the GLPs, the semaglutide, but I'm like, the way I do things is we really have to address the elephant in the room, which is you're an ovarian failure. And just like if you had your thyroid removed and you had no thyroid, you have no ovaries. And so we have to address that, because all the weight loss shots in the world is not going to help if you don't address the underlying problem. Okay. So, and then I mentioned the pull test. So pull and see how many strands that fall out, or just download the free ebook, and you can read all the different, it kind of takes you through step by step how to self-diagnose, and then what lab tests you might want to ask for as well. So I have another board over here. I don't know if I can just move this here and you can see it. Yes, I can. Okay, cool. So disregard that. I already talked about that. But some meds that could work would be minoxidil or DHT blockers. And this is fascinating. Melatonin. You can actually use topical melatonin for your hair. Oh, for your spirit. That's cute. Heidi, probably why GLPs didn't work for me. Yeah, absolutely. Yeah. And estrogen actually stimulates your body's own natural GLPs, because you make GLPs, but can really be effective if you don't have estrogen, because estrogen stimulates GLPs. Okay. So melatonin, you don't have to take it orally, but melatonin actually helps your immune system too. And our natural melatonin declines as we go into ovarian failure too. It just kind of piggybacks on estrogen. Of course, bioidentical hormones and probiotics, leaky gut, address that. Topical probiotics, iron, biotin, zinc. We talked about that. Your methylfolates, vitamin D. Assess the medications that you're on. Watch the chemicals. Try to eat the least amount of processed foods that you can. Get plenty of sleep. Progesterone helps with sleep, so bioidentical hormones come back again. The saw palmetto, we mentioned that. We can do PRF. I didn't fill in my 13 there, but you can do PRF, microneedling, injections of exosomes in the hair, all sorts of things. But those are, just things that you can do, but don't have to do. So anyway, all things hair. That was a lot in one night. So again, go get my freebies and the downloads, and you can learn all sorts of cool things. And I have my hormone books. Please, if you haven't, get the Why Did My Doctor Tell Me I Can't Take Hormones download, and share that with as many people as you can. Download that and share it with your friends, with your daughters. I mean, it's time to have those conversations with our daughters and granddaughters as well. Just because they don't know, and they're going to be so behind the 8 ball when it comes to perimenopause or menopause. So go look at all those things and print it off if you want, or go buy the books on Amazon and stuff. And hey, I got a deal. If you want a copy of my Balancing Acts book, I don't have it here. I don't know what I did, but we can totally do that. All you have to do is pay shipping. So if you want to email info@hormonebliss.com, and you want us to send you like a for real copy, I think shipping's like $10. So if you want to just email us, we can get a book out to you. So love to do that. It's got a place you can take notes and everything. I don't know what I did with my book, but a place you can take notes and everything in it. So that's a cool book. But I have lots of other ones too. Okay, wild yam cream. So wild yam cream does have a phytoestrogen in it, which is great. But I always say there ain't enough yams in the world. I could eat a bucket of yams and never compare to what you can get through your bioidentical hormone cream. So yeah, I mean, it can help, and it can help with hot flashes and things, and it's better than nothing. But when people tell you that hormones are bad or hormones cause cancer, and then all you do is go get wild yam cream, it's just not enough. I mean, it's not enough to compensate for what your ovaries once did. So, but it is something. But it makes me so angry that we have this narrative that hormones cause cancer. Because what hormone, number one, if you're going to say estrogen, what estrogen? And then the WHI study in 2002, it was actually the synthetic progestin arm that went a little haywire. So it's not even estrogen, it's the synthetic progestin. So anyway, I have a whole video on that somewhere in my feed, so you can go find that too. Bioidentical. So Yeah, usually we do anywhere from, this one I'm holding is 75 milligrams of bioidentical progesterone. The most you could get from a Yum cream is probably 10 to 15. So yeah, I mean, it's just not enough. Now, for some people, it probably works fine, and some people have good adrenal function, and it's probably okay. But yeah. Okay, so I'm at the end of my time. So if you go to my link in bio or you go to hormonebliss.com, you can get a lab test. Super easy to do. It's just a fill out this form. Tell us all 70 symptoms of yours that you have. I'm so sorry. People are suffering. This is legit. This is real. But fill that out and then put a little saliva in the tube and then send it off. Free shipping to you and free shipping to the lab. And then included is a consult with one of our hormone coaches, and they will talk to you about your labs and tell you a plan and how to get you on some bioidenticals. And yeah, so the consult's absolutely included in that. So like you can even go, like if you come see me in my practice, it's a bit of an investment. I mean, it's like getting braces. So to be able to do this like for a little over $100 and be able to talk to these people that I've trained in our protocols is like amazing, crazy deal. So go get your kit. And even if, you choose for whatever to not do hormones right away, but if you follow me here enough, I'm here every night at 7 o'clock. If you follow me enough, I think I will make a very good argument for you to consider hormones. So yeah, so do that. So hormonebliss.com and or you can go to my link in bio, watch my videos, all the things. I'm just here to share. I love you guys very, very much, and just stay strong, stay empowered, and let's just move this up a notch and take the suffering out. Ovarian failure is inevitable. 100% of women will go through it after the age of 50, somewhere in there, but suffering is not. Yay, Sharon, you got your kid. I love you. I love you. We love you too. Oh, Lane, I love you too. Okay, y'all have a fabulous evening. And I haven't picked my topic for tomorrow night. I kind of just pick them on the fly. I mean, it was just like, okay, my hair was looking like crap today. So I was like, okay, let's talk about hair. So if you guys have a topic that you want to talk about, you can direct message me and tell me what you want me to talk about. Otherwise, it'll probably just strike me as the mood tomorrow. So anyway, okay, have a fabulous night. See you tomorrow.